Okay, so imagine this. Watching a tumor just disappear. Not with surgery, not with harsh drugs, but just with sound.
Yeah, like it's being erased right in front of your eyes.
Exactly. We're doing a deep dive today into something pretty revolutionary, a cancer treatment using ultrasound.
Yeah.
Let's, really unpack how this works. It's kind of mind-blowing.
It really is. And the basic idea right from the start, it's about using focused ultrasound. Think of it like really concentrated sound waves.
Okay.
And using those to target and just break down diseased tissue, all at a cellular level. And crucially, without making any kind of incision.
Wow. No cutting.
No cutting. This is called Histotripsy. And it's been on quite a journey. Started out in research labs, University of Michigan, actually.
Right. I read about that.
Yeah, and then this company, HistoSonics, they took it and really pushed the development for, actual clinical use.
And that journey just hit, a huge milestone, didn't it?
It really did. The FDA has now given clearance for HistoSonics device.
For treating liver cancer specifically.
For liver cancer, yes. So hospitals worldwide can start using it.
And for you listening, if you're trying to stay ahead of what's next, this is really significant.
Definitely. Years and years of work, research, development, it's all led to this. A brand new tool against a really tough disease.
So this deep dive, it's about getting a really clear picture of this alternative, why it could be such a big deal.
And if you think about the context, why this is so important, well, liver cancer. It's often caught late, right?
Yeah, often too late for surgery to be a clean option.
Exactly. And the standard treatments, chemo, radiation, they can work sometimes, but they're hard on people. Really harsh side effects, long recovery.
Right. Lots of downtime, feeling awful.
Tripsy is just, it's a different path altogether. Potentially, transformative because it avoids all that invasiveness.
Okay, so how does this sound eraser thing actually happen? It still sounds a bit sci-fi. What's the core mechanism?
Yeah, it does sound a bit like that. But the mechanism is, well, quite clever. Histotripsy uses these really short bursts of sound. We're talking millionths of a second.
Microseconds.
Microsecond pulses of highly focused ultrasound energy. They're aimed right at the tumor.
Okay.
And they interact with these tiny, tiny gas bubbles that are already naturally present in the tissue, nanometer-sized pockets.
Gas bubbles already there.
Yeah, trially occurring. The ultrasound pulses hit these, make them rapidly expand, and then violently collapse.
Expand and collapse, like tiny little explosions inside the tumor itself.
That's actually a pretty good way to think about it. This super fast expansion and collapse, it creates intense mechanical forces, tiny shock waves, basically.
Right within the tumor cells.
Right around them, yeah. And it's that mechanical stress, that physical force, disrupts the cancer cells, breaks them apart.
So the sound waves are literally physically destroying the tumor structure.
In a very real sense, yes. They are mechanically breaking it down.
That's wild. Okay, but what about the person? What's the patient actually experience, like right after the treatment?
See, this is where it gets really compelling. Because it's non-invasive, so targeted, the recovery is incredibly short.
How short?
Well, many patients, they have it under general anesthesia, but they report feeling well enough to leave the hospital really soon after, sometimes even the same day.
The same day as a cancer treatment?
Yeah. There are these anecdotes, patients asking the doctors, did you actually do anything? Because they felt so little pain or discomfort.
Wow. They questioned if it even happened.
Exactly. Imagine that.
Yeah.
Going in for cancer treatment, walking out feeling, well, relatively normal.
That is just a night and day difference compared to surgery recovery or chemo side effects. Really highlights how much less disruptive this could be.
Absolutely.
But, okay, promising anecdotes are great, but what's the hard evidence? The clinical trials. Did they show it actually works effectively on liver cancer?
Crucial question.
Yeah.
And yes, the effectiveness was tested properly in the Hope Before Liver trials.
Hope Before Liver, okay.
These were run in multiple places, Europe, the U.S. They included patients with primary liver cancers, starting in the liver, and also metastatic liver tumors, cancers that spread to the liver from somewhere else.
Right, secondary cancer.
Exactly. Yeah. And the results from those trials, they showed significant success. Histotripsy was effective in treating these liver tumors.
And the platform they used, that was the HistoSonics Edison system, the one with the robotic arm for targeting.
That's the one. The Edison platform, it's very sophisticated. It lets the doctors deliver that ultrasound energy with really high accuracy.
How does that part work? Is it like a normal ultrasound?
It starts off similar, yeah. The device goes on the patient's abdomen externally. The clinicians use the imaging part of it to see the tumor, pinpoint it.
Okay.
Then the robotic arm helps make sure the energy goes exactly where it's supposed to. Once they've locked onto the target, the treatment itself is pretty much automated. Yeah, the system delivers the pre-planned ultrasound pulses, and it's watching the whole time using real-time ultrasound feedback to monitor the treatment zone.
So it's imaging, robotics, and those focused sound waves all working together. That's quite a journey from just noticing this histotripsy phenomenon in a lab somewhere.
Oh, absolutely. It's a huge leap, turning a basic science discovery into a real working clinical treatment. That takes an incredible amount of engineering, developing specialized equipment, figuring out the protocols for using it safely, effectively.
The university research laid the groundwork.
Exactly. University of Michigan's research was fundamental, showed the potential. Then HistoSonics did the essential job of, engineering that potential into a reliable device doctors can actually use.
You mentioned the accuracy. There was something about a dark color ablation zone. What does that show the doctors?
Right. So during the procedure, the clinicians are watching on the ultrasound screen in real time. This dark color ablation zone is basically a clear visual sign. It shows the exact area where the cancer tissue is being actively destroyed by the ultrasound.
You can see it happening.
You can see it happening. And what's really striking is that right outside this zone, this bubble of destruction, the surrounding healthy liver tissue looks undamaged.
Really precise.
Extremely precise.
Yeah.
Almost surgical, but without the knife. And that precision is key to minimizing side effects, helps explain those fast recovery times we talked about.
That precision feels particularly important when you think about who gets liver cancer. It's not just older people, right?
No, unfortunately not. Cancer hits all age groups. And sometimes younger patients, maybe they weren't getting regular screenings, their cancer might be found at a later, more advanced stage.
Making treatment options even harder.
Exactly. So the hope is that a less invasive, more tolerable treatment like histotripsy could be a real game changer for them. Let them get back to their lives faster.
And the potential doesn't stop at the liver, does it? There was mention of using it for other tumors.
That's right. There's a lot of excitement about applying histotripsy to other solid tumors, kidney cancer, pancreatic cancer. Those are being actively investigated.
So active research ongoing.
Yes, and the early results look promising. But even beyond cancer, the basic idea, precisely controlled mechanical tissue destruction, people are looking at it for neurology applications, cardiovascular medicine too.
Wow, really broad potential then.
It really could be a platform technology with impacts far beyond just oncology in the long run.
And speaking of broadening access, we heard about a clinical trial starting up in Singapore soon.
Yes, that's happening. The National Cancer Center Singapore and the National University Cancer Institute Singapore, they're planning to launch a histotripsy trial later this year.
For liver cancer patients there.
Yes, starting with an initial group of about 40 liver cancer patients. It's a really important step in making this treatment available in Asia.
That trial definitely shows the growing global confidence in this. So let's just quickly sum up those key advantages again. Compared to, say, surgery or radiation, what are the main benefits?
Sure. The big ones are, first, it's non-invasive. No cuts, no incisions.
Right.
That directly leads to minimal or even no pain afterwards. And recovery is much, much faster.
Potentially going home the same day.
Potentially, yes. Think about that young mother anecdote again. For someone facing a tough diagnosis, the idea of a treatment that doesn't involve major surgery or long, painful recovery, that offers real hope, a better quality of life during and after.
That human impact is huge. Now, the unavoidable question, cost. Cutting-edge tech is often expensive. What about histotripsy?
Cost is always a major consideration, absolutely. And it's complex, varies by healthcare system, insurance, all that.
Sure.
But it's important to think longer term, too. If you have shorter treatment times, fewer complications, much shorter hospital stays, faster recovery.
Less burden on the system overall.
Potentially, yes. It could actually lead to significant savings in the total cost of care down the line. The initial tech investment is there, of course, but the potential to reduce the overall economic burden compared to traditional treatments is definitely part of the picture.
That makes sense. Looking at the whole cost, not just the upfront price tag. So is histotripsy meant to replace other treatments or work alongside them?
It's really about adding another option, expanding the toolkit for doctors and patients.
Okay.
Whether someone needs other treatments too, like chemo or immunotherapy, that depends entirely on the specifics, the tumor stage, the patient's health. Histotripsy gives them a powerful, non-invasive choice that might be perfect for certain situations or certain patients.
And that Singapore trial you mentioned, it sounds like a big collaboration is making that happen.
Absolutely. It's backed by philanthropic support. The Li Ka-shing Foundation and Temasek Trust were mentioned. And it's a real partnership.
Between who?
You've got the clinical experts at the National Cancer Center and National University Cancer Institute in Singapore, the tech innovators at HistoSonics. And yeah, full disclosure, I was involved in co-founding HistoSonics, so I know the effort involved firsthand.
Oh, okay.
And then the foundational science from the University of Michigan, all working together.
Why is that kind of public-private mix so important for something like this?
Because getting something truly new, like histotripsy, from a lab discovery into actual patient care, it takes so many different things. You need the initial science, often from universities.
Right.
You need companies like HistoSonics to do the hard engineering, build reliable devices, navigate regulations. Then you need the hospitals and clinics to run trials, deliver the treatment, and you need funding bodies to support it all.
It's an ecosystem.
It's totally an ecosystem. Each part is essential to make it happen.
And the Singapore teams, they can build on what's already been learned elsewhere, presumably.
Exactly. Besides the liver cancer approval, there are those ongoing trials in Europe and the U.S. looking at kidney and pancreatic tumors.
Right, you mentioned those.
And the early data from those is also looking very positive. High success rates in destroying the targeted tumors, and importantly, a good safety profile so far. Minimal side effects seem to be a consistent finding.
Okay, that's encouraging for wider use. And there's one more thing, possibly one of the most surprising aspects. Something about the immune system.
Ah, yes. This is a really fascinating area that's still being explored. There's emerging evidence. It's still early days, mind you. But it suggests that in some cases, the process of destroying the tumor with histotripsy might actually trigger the patient's own immune system.
Trigger it how? To do what?
To recognize the cancer cells as foreign and attack them. And potentially, this could lead to the immune system attacking other tumors elsewhere in the body, ones that weren't even targeted by the ultrasound.
A systemic effect from a localized treatment.
Potentially, a systemic anti-tumor effect.
Yeah.
It's still being heavily researched, but if this pans out, it adds a whole other layer of benefit. Very exciting possibility.
It really is. So wrapping up this deep dive, it feels clear histotripsy is, well, a potentially game-changing step forward, especially now for liver cancer, but maybe much more down the road.
The non-invasive part, the precision, the quick recovery, those are just incredibly powerful advantages for people facing cancer.
Definitely.
And it does make you think, doesn't it, about the future. If we can target disease so precisely, non-invasively, what else could technologies like this do?
Beyond cancer.
Beyond cancer, could we revolutionize how we treat all sorts of conditions? More effective, less disruptive medicine? It's a really interesting future to consider.
It certainly is. A lot to mull over there. Well, thank you for taking this deep dive with us into this really remarkable development.
My pleasure.
Until our next exploration.